Thank you very much for the invitation, and thank you for, yes, these are difficult times, but thank you for bringing NTDs still on our radar, because in these times, it's one thing that can be sometimes forgotten. So it's good to be able to find a chance to speak about NTDs, and particularly about the NTD roadmap. So thank you very much.
No, thank you so much. Absolutely. And I think if one thing's been absolutely apparent from the last few weeks and months, given the COVID-19 situation, is that has really put healthcare systems and universal access to healthcare right in the forefront of everyone's attention. It's put it really center stage and really brought home the message that we're only as strong as our weakest health system.
Exactly.
So,
exactly.
Which overlaps with your work in neglected tropical.
And what we are focusing on is exactly that. And in the new roadmap, we say so, because at the end of the day, it's NTDs are reaching people beyond the end of the road. And that is where sometimes the health systems are weakest. And I think, getting this discussion ongoing, recognizing that we are, like you said, we are as strong as our weakest link. It does mean that, or our weakest health system in this case, it does mean that we do have to place a greater emphasis, first of all, on our normal, because we've seen health systems that are quite functional but have been totally unable to cope. So can you imagine these systems which are very, very frail and fragile? So it's an opportunity to really reflect very, very seriously on how we take health, and how, if we sincerely believe that health for all is an integral part of our life as human beings, then we must make it so.
Absolutely, Mwele. And I think you are known to all as a very passionate advocate for these diseases. So we kind of went straight into the topic. I didn't even have a chance to introduce you properly. Not that you really need an introduction, but perhaps for some of our attendees who are not immediately in the field of neglected tropical diseases, I just wanted to say a few words about yourself. It's really our great pleasure today to welcome Dr. Mwele Malecela, Director of the Department of Control of Neglected Tropical Diseases at WHO, so based in Geneva. Mwele, you come with a huge amount of experience, both as a researcher, as someone working on control programs in NTDs, and then also political experience, and as truly a great leader. So, Mwele, you started off your work particularly focusing on lymphatic filariasis, and this led you to becoming, over the years, Director General at the National Institute for Medical Research in Tanzania, the NIMR. In 2017, you moved on to the WHO's Regional Office for Africa, and then recently in 2018 to the WHO NTD in Geneva. And all along the way, you've really led national, international efforts to control lymphatic filariasis, as well as a lot of other NTDs. And I think, you've been described quite recently on Twitter as a visionary leader and someone who is working for real change in the fight for equity and health for all. So we are very lucky to have you trying to, undertake this enormous task of creating a roadmap for well above 20 diseases, all with their own characteristics and challenges. So a roadmap to guide the effort for the control and elimination of neglected tropical diseases between now and 2030. And as if that wasn't challenge enough, throwing in the COVID-19 pandemic right at the start of it.
Thank you very much for your kind words of introduction. I am extremely passionate about the NTDs, And just to tell you that today is, we are commemorating Chagas Day for the very first time. Chagas, which is also called American trypanosomiasis, is also known as a silent killer because it comes with very few symptoms and very confusing symptoms sometimes. And so we have on our website and on our social media, we've just been talking and raising awareness on Chagas disease. So please feel free to look through and see what we're saying about Chagas disease. But this is the first time it's being celebrated worldwide, April 14th, and it's linked to the, I think, birth date of Carlos Chagas, or the day he discovered the Chagas disease. So once again, thank you very much. And it's something of an understatement to say that we are in difficult times. And the COVID-19 pandemic has prompted every country to implement unprecedented public health measures. And WHO continues to provide guidance to member states to assist them with quick and confident responses to this emergency. A range of public health measures are being implemented that include hand hygiene, respiratory etiquette, and practicing physical distances. To be consistent with these public health measures, particularly physical distancing, WHO recommends that community-based surveys and active case-finding activities, as well as mass treatment campaigns for neglected tropical diseases, be postponed until further notice. This is a sad but necessary move. As we work to cope globally with the COVID pandemic, we are particularly mindful of the fact that in order to effectively protect our populations against both known and unknown diseases, we need a number of elements. And we spoke about this a few minutes ago with Marianne about the being as strong as your weakest health system. These include comprehensive scientific understanding, diagnostic tools, effective interventions, and above all, a functioning, equitable health systems which allow us to reach the most vulnerable members of our community. This will not be news to members of our worldwide neglected tropical disease community. The need for integrative initiatives and strategies is becoming a rallying cry for all our community. The NTD landscape has changed significantly over the past decades, and with the help of a whole host of dedicated partners and donors, a great many countries have been able to put in place systems that have allowed them to make a significant difference. With the support of donations by pharmaceutical companies, great strides have been made in scaling up control and elimination programs, and this has assured that more than 1 billion people globally have received treatment in successive years from 2015. 2015, 2016, 2017, and 2018 has also showed similar figures. And these are proof that the progress that the community of which I am proud to work has made. There have been unprecedented advances too in many diseases, notably sleeping sickness, guinea worm, lymphatic filariasis, and trachoma. More people than ever before are receiving high-quality trichiasis and hydrocele surgery as programs evolve to include morbidity management as a fundamental component. In 2018 alone, the WHO recognized 8 countries as having eliminated at least one NTD. We have also a historically low number of cases of human African trypanosomiasis. For the first time, 1,000. Visceral eliminated in Bangladesh and Nepal, and the cases of Buruli ulcer globally have decreased by almost 60% since 2018. These achievements are a source of great pride to all the people who have played a part in bringing them about. And although we describe them using percentages and statistics, behind these figures are lives that have been saved, improved, or made disease-free. People, that is, who are able, as a result, to make their own unique contributions to family and community life. Back in 2012, the WHO released its first roadmap, and it was titled Accelerating Work to Overcome the Global Impact of Neglected Tropical Diseases, a Roadmap for Implementation. This roadmap helped guide the implementation of policies and strategies globally and to steer a multitude of partners in supporting our work. Given the context and need of the moment, this has been largely successful, despite a vertical approach. Now it falls on us to consider the way forward and to reflect on our strategies, to evaluate what worked well in the first roadmap and what needs to be revisited and revised for the next decade. With that in mind, in 2019, WHO started to consider the provision and planning of a new roadmap. We spent a lot of time engaging with and active eliciting stakeholders and made all possible efforts to listen and learn from them. And all of this was done in an effort to ensure that the new roadmap from 2021 to 2030 is even more ambitious than its predecessor, and that the ambition is thoroughly grounded in evidence and pragmatism. The result is a draft roadmap of which I, on behalf of all those who contributed to it, am very proud. It has been developed for the next 10 years, which, if the first few months of 2020 are anything to go by, will require our unwavering dedication and commitment. I am proud that our new roadmap, however, because I believe it represents and reflects the interests and viewpoints of everyone who was involved in its development, from individual countries to program managers, from scientists to healthcare workers, donors and NGOs, numerous individuals and organizations who gave generously of their time and expertise to help us develop this roadmap and who shaped and molded it with their passion and commitment. The process of drafting the road has allowed us to reflect on in this next phase, as well as highlighting the many challenges we face. The heat map component of the roadmap, for example, provides an at-a-glance view of some of the bottlenecks and potential barriers in reaching our targets for 2030. For example, we note that diagnostics, monitoring and evaluation, as well as advocacy and resource mobilization remain key factors. Overall, we need to ensure that the boundaries of scientific understanding are pushed at continuously, and that research and development remains a core element in our activities. We already know that certain gaps in our existing knowledge, in our existing knowledge, holds great risk not only for investments in the future, but for gains we have already made. That is why one of my main messages has to do with striving to ensure that our work, efforts, and programs are cross-sectoral. This means working with our colleagues and experts in education, water and sanitation, food safety, nutrition, and climate change adaptation, as well as vector control. It means maximizing our efficiency at a time when donors and policymakers and program managers are all under pressure to do more with limited resources to scale up and increase impact. Pooling our time, resources, capabilities across sectors will not only be desirable, it is essential. Integrating our various approaches must not only look good on paper, it must form the basis of our actions on the ground. In 2019, WHO was particularly proud that in conjunction with NGO partners, a toolkit was published for WASH, water and sanitation and hygiene, and NTDs. This toolkit provides a step-by-step guidance to the NTD program managers and partners on how to engage and work collaboratively with the WASH community to improve the delivery of water, sanitation, and hygiene services to populations affected by many NTDs. Primary prevention, control of NTDs, and management of NTD-related disabilities relies heavily on access to safe water, sanitation, and hygiene. There are numerous NTD transmission routes that can be interrupted with improved WASH in diseases such as trachoma, schistosomiasis, soil-transmitted helminths, and guinea worm, to name but a few. In addition, improved WASH is vital to NTD-related wound and morbidity management and disability, for example, in leprosy, lymphatic filariasis, and Buruli ulcer. This toolkit was our first step. In our previous roadmap, access to safe water services, WASH services, were deemed key for prevention, intensified control, management, and elimination of certain NTDs by 2020. This is not to say, however, that there isn't still a great need for operational research on the feasibility and effectiveness of pairing specific WASH interventions with specific NTDs. But I've talked thus far about some of the strongest aspects of our existing NTD networks coupled with WASH integration. You will not, no doubt, see what I'm clearing coming to. At this particular moment, it is important that we, as WHO, as countries and programs, encourage local health authorities, when and where feasible, to use existing NTD platforms for surveillance mechanisms, WASH and health education opportunities to support the implementation of COVID-19 related measures. And I insist that this should happen only where it is feasible and only when these platforms in the form of community health workers can be ensured of safety. I come back to the beginning of the experience as an NTD community, work to our public health interventions. It is unfortunately inevitable that certain NTD programs and other community-based programs will be affected in the immediate term. We as a community will remain open to updating our advice and supporting countries in order to ensure that we protect our health workers and health programs. Currently, we are working on modeling to try and see that what will programs be like post-COVID? What can we do to ensure that we can catch up with some of the delays created by the COVID pandemic? In the medium term, it is just as important that we ensure that essential health services such as NTD interventions requiring treatment of individuals, for example, human African trypanosomiasis and leishmaniasis, bed nets and treatment for malaria are not neglected or forgotten, thus causing another wave of suffering. Door-to-door interventions may not be feasible or appropriate in the coming months, but we can work with our partners on the ground to ensure that alternative arrangements are found, and depending on the local circumstances and public health directives issued in specific countries. What then of the post-COVID landscape? The pandemic has shown us that countries who have been able to respond most effectively have been those with the most resilient and equitable health systems. The practical case for universal health for all approach has never been more promising. The 2030 Roadmap is a direct response to that, promoting resilience, health system strengthening, equity, and most importantly, country ownership. These are the basic building blocks, and they will enable us not only to eliminate, control, and eradicate specific NTDs for billions of the most vulnerable people in the world, but to demonstrate in our collective action that regardless of any other factor, health for all is a human right. Thank you very much for your time, and I welcome any questions and comments that you might have.
Thank you very much, Mwele. That was actually a very inspiring talk, a very important way to phrase it. NTDs affect over 1.5 billion people worldwide, and ensuring solid and well-rounded provision and access to healthcare for those at risk of NTDs and suffering from NTDs is a very important part of the way to ensuring overall security in terms of health. So we've got a few comments here. Quite a few people are saying thank you very much. Yubatal Akilo, Matt Mason, Simon Cathcart, Maria Paula Costi, hello and thank you. Colleague Roman Velayudan, Rand Guldalash, so perhaps lots of familiar names. Everyone saying thank you very much, Dr. Malecela, for this talk. You've got a question here from Mary.
Mm-hmm.
Not sure, Mary, which organization you're from. Feel free to let us know. Mary's asking, how can we best harness the heightened global awareness of infectious diseases that's occurring at the moment because of COVID-19, and how can we harness that for NTDs?
Yeah. Okay, so thank you very much, Mary. Thank you very much, Mary, for your question. How do we harness? I think one way is just how do we use our current platforms for NTD? I think that the most important thing is how do we, in the current situation, how do we use our platforms, how can we use our platforms safely to support the COVID pandemic? How can we do it in towns and villages and in places where there is very little access to services? What can we do without putting people in danger? What can we do? Can we, for example, one example I gave was the issue of WASH messaging that could be done by community health workers if the situation was appropriate. That would be one way. They have already been doing this for NTDs. Can they do it for COVID-19? I think, first of all, as members of the NTD community, and we have to be responsible members of the NTD community, is to first of all make sure that we contribute in any way that we can to this. Then I think, you know, we need to continue to raise our voices, like in forum like this, to say that NTDs are still a problem. You know, they affect the poorest of the poor, and in situations like this, it exacerbates. It just shows that these are the people who are going to be mostly not going to be reached by the health system. So we really need to, in the first instance, support the pandemic in any way that we can, and in the second instance, talk about NTDs and how they affect the poor and the vulnerable, and how by really using these platforms, investing in these people, you are actually addressing the issue of the weakest part of our health system.
Absolutely. And perhaps as well, the common link to all these diseases, you know, particularly COVID-19, we hear a lot about the healthcare workers in the front line. And for many communities, those may also be the same individuals who are working across the whole spectrum of diseases under other circumstances. So perhaps that's also a common theme that could be explored, to bring in NTDs into the conversation at a time of COVID.
And of course, the poverty element. I mean, that's going to be forward, I think, and we see it in some of the other countries where in poorer populations we are seeing higher numbers of people infected, mainly because some of them, there's a difficulty in practicing physical distancing and so many other reasons, and being undernourished and other things. So I think you know, we're going to have to look at this. There is, you know, there are people looking at it in a gender lens, but the poverty lens is very, very clear, and it's one that we are going to continue to look at, and particularly in the context of NTDs.
Brilliant. Mwele, you had a couple questions that are kind of on the theme of, on a programmatic level. Helena Uliartha, who's from the Ministry of Health Indonesia, was asking, in this pandemic situation, I think that the post-MDA filariasis stage, especially for transmission assessment, surveillance, and so forth, will be challenged due to the pandemic. How do you respond to this? Is post-validation guidelines for lymphatic filariasis available now? And in a separate question, Rita Oliveira from SIF, based here in London, is asking, how should countries decide on when to start MDA again?
Okay. So the first person who asked, I'm sorry, the name?
Helena Uliartha.
Helena, yeah, from Indonesia. Helena, thank you very much for your question. And you know that those are the areas which we know are going to suffer intensely by because of this outbreak. We know, for example, we know for a fact that particularly dealing with post-validation surveillance, that this is something that cannot be carried out at this time, and so it will be an issue for us. And what we are trying to do is to try and work with modelers to see what are the things that we can do, both with the MDA in terms of, in some cases, when we model, can we look at maybe 2 times MDA, etc., and also trying to look at what needs to be done to enhance our post validation surveillance, so that we base our strategies on clear guidance, because we don't want to base our strategies on just what we think or a hunch. We want to be sure that we have at least some evidence for models that will be able to guide us. So that's where we are in terms of looking at how can we do better, and we're really working, and maybe later on I can share an email in which, when anybody who has any ideas, particularly about how we can work in the future, can share their ideas. Or maybe, Marianne, if you have a platform, people can share their ideas on how best to support the programs post-COVID. So my suggestion to Elena is that we will give you as much guidance as we possibly can, but we are working with our modelers to see what is the best approach post-COVID. So we're already looking at what will happen after COVID. For Rita Oliveira, when to start MDA? Again, this will be a difficult question for country by country, but we will give kind of a scenario situation in our in-depth guidance. Once we start seeing that the pandemic, that countries are opening up, we'll give guidance as to graded guidance as to in what countries when should you open. Otherwise, it's very risky for us to be saying one thing, whereas as an organization, we've already talked about physical distancing and really mentioned the importance of physical distancing. So MDAs will happen only when countries are able to actually, in many ways, kind of contain the spread of COVID-19. So we will not be encouraging MDAs for now. It will be a while until we do, and we'll be happy to share some guidance on that when the time comes.
We'll be taking WHO certainly. A quick question from Isaac Chikwana from GHIT Fund, GHIT. Thank you for your presentation. And how will the COVID-19 pandemic impact the launch of the roadmap?
So first of all, we need to find out whether, because the roadmap still has to go through the World Health Assembly. So a lot is dependent on that, but we are planning for a virtual, what we were calling a technical launch, which is going to happen on June 17th here in Geneva. So it will be a virtual launch if all goes well with the World Health Assembly and the roadmap is approved at the Assembly. Then we'll have what we're calling a virtual technical launch. As far as the launch in Kigali, I think we'll wait to hear from Uniting to Combat NTDs about where we stand with that.
Absolutely. So quite a few questions as well, or comments around COVID in terms of hand washing and wash facilities and overlaps with NTDs. I'll just take here, for example, a question from Martin Coleman. Hello, Martin, from CBM Kenya. Hi. Thanks a lot and really appreciated. would it be possible to send country NTD programs some detail on how to use NTD platforms for what is called inclusive emergency wash, as well as shielding approaches to protect the most vulnerable? And how can we best link this with livelihoods to mitigate impact?
I mean, that's an excellent question, Martin, and I recognize. I think you recognize that what we have given, often what we have shared now, is interim guidance, and we are in the middle of trying to work on more kind of detailed guidance that we can give the countries, and that detailed guidance would also include how we can use the platforms. I think the most important thing is how we can use them safely without then exposing these community health workers and others to COVID-19. So I think we need to be very careful about that. The livelihoods question is an extremely important one, and how we handle, because I mean the biggest problem for lockdown in Africa has been the issue of livelihoods. There's been an issue of what do people who earn, whose daily living is found by going out there and doing these activities and cannot do them. What do we do with them? How do we support them? And in various countries, support for people has been in various forms. Others have done food support. Others have done shelter support, and it's been different in different countries. But I think it's something that we need to think very carefully about, and specifically because our NTD community are in the poorest of these populations. What can we do? And I think I definitely throw that question back at you, Martin. What as a community can we think about things that we can do to support, particularly, I mean, this is not a place where we can say NTDs can go out and do this, but how can we encourage our other partners who are working directly on livelihoods to do this kind of support, and give an example of what we know in the NTD community. These are people who are, in most cases, poor and malnourished already. And so what can we do to amplify this message to our colleagues who are working more on the livelihood side?
Extending on a bit in terms of the WASH issues, the WASH aspect of COVID-19, Rosa Castelia Ribeiro Soares is asking pointing out the main recommendation on preventing COVID is washing hands, and which will impact on some NTDs very positively, such as STH. And one challenge will be to maintain hand washing practice as a kind of legacy of this COVID tragedy. How can we best direct the lessons learned to NTDs? And in fact, probably more broadly, I think even, here in the UK, where I'm speaking from, hand washing statistics can be quite depressing in normal times. So what would be the best way to hang on to those very positive gains?
I think this I like Rosa's mentioning it as a legacy. I think it really is something that we need to take forward, because we have really, as an NTD community, been trying for STH, for trachoma, for lymphatic filariasis, Buruli ulcer. We have really been encouraging the importance of hand washing, in some cases limb washing, to support to be able to get to elimination of some of these diseases. But we have not had a situation whereby a huge proportion of the population is actually adhering to it. Even in places where water is scarce, people are choosing to wash hands. This is something that COVID-19 has brought to us, that no public health initiative or whatever has been able to garner this kind of momentum. So I think what we need to do is to not lapse and make it just a COVID-19 issue. I think we should make it into almost like a social behavioral issue. We've started doing it for months now, and people washing their hands every hour. Can we move this? Can we make it an actual global movement to say, yes, COVID is over, but let's keep washing our hands. Let's wash our hands so we can fight against NTDs. Let's wash our hands so we can fight against so many other infections. Let's just keep our hands clean and keep on this. And I think taking it as a legacy, that this is something we learned. This is something we've been comfortable with for the past almost 8 weeks for some of us. So I think, we just need to continue to reinforce those messages. And I think the other area where I found these messages are being reinforced a lot. This was before even the lockdown. I went and visited my daughter's school back in Tanzania, and they were already like every hour on the hour going out and washing their hands and washing their hands and singing happy birthday, and each one of them. And at first it was quite hysterical to me, but after a while, not hysterical because they were doing that, but it was just the lining up of students, making them wash their hands, and and everyone had to do it for sing happy birthday and wash their hands. So there was an element of patience, an element of waiting, but everybody did it, and this was repeated every hour. So for me, what I learned from there is that if we can keep this and get it to our children, then this is something that can be done. Now, albeit, having said this, there are places where you will not be able to get running water, and so this is an example given in a kind of situation where there is running water, but where there's not running water, what do we do? So it continues to make the case for running water being available everywhere, and it makes the case that whatever little water is available, hand washing, face washing is critical for us to move forward in NTDs and in other public health programs.
Well, I'm conscious of the fact we've been talking for 45 minutes. You have a lot of questions because everyone's really thrilled to be able to ask your advice and opinion on a lot of these issues. Is it okay to still carry on and take a few more questions?
Absolutely, absolutely.
Okay?
Yes, absolutely.
Brilliant, thank you. So moving on slightly from the wash aspect, we have a question here from Fiona Allen from the Natural History Museum in London. Mm-hmm. Thank you for a lovely presentation, and hello, Fiona. Do we know any interactions between the different NTDs and COVID-19? Has anything been noted on the virus and added susceptibility for communities that already are impacted with NTD?
Not at the moment. So I would just respond by saying, for now we do not, and when we do, we will definitely be in a position to share. But for now, we do not have any indication that there is a direct link. The only thing that we're saying is that some of these underlying situations, such as undernutrition, could be a problem for people with COVID-19. But otherwise, we don't have any direct links.
Thank you. A question from Raman Velayudan. Mwele, here in the US, it may also be Charles Mackenzie, Michigan. So I think they've both signed on, perhaps using the same login. So either Charles or Raman. Hello to both in any case.
I think it's Charles. Charles is in the US.
It is Raman. Charles. Okay. Hello, Charles. Mwele, here in the US, one of the issues in controlling COVID is testing. Is there a way that NTD expertise in testing can be used to assist in controlling COVID?
Absolutely, Charles. And I think, we do have we do have that capability, and we definitely can use it, and we can test. I think the beauty of sorry, my battery's running low. The beauty of our situation is that we can test right down even below the district levels. And so, if countries were to use those platforms which are available to them, I think it would be really very useful for them. You have institutes which could be used for quality control, which are being used for quality control for NTD testing. And so I think this is an opportunity, and I know that many countries are thinking about it, but it is available, and maybe we should just continue to to indicate that this is available, and that as a community we would very much like to see this being put to use, because we do have the capacity, and countries shouldn't feel stressed when actually the capacity to test does exist. And so I think what will be the problem is that will countries have enough tests? That will be the problem. But I think the infrastructure for testing is there in a number of countries, and I think countries should just be cognizant of it and want to use that infrastructure.
Brilliant. From Luisa Freitas from the IDDO, one of the targets of the 2030 NTD Roadmap is to eliminate STHs by 2030. And Lucia is asking, since STH treatment, which is albendazole, has been used with LF treatment, DEC, are you confident that this target can be reached once LF elimination has been reached? Because we know that routine deworming program alone is not sufficient to eliminate STH.
So I think one thing that we did with our targets this time, and I think that's one thing that we've been very careful about, is to set the targets in the current conditions with the current tools that we have, and with the current strategies that we have. Now, one thing that we're very clear about is that we will be evaluating every 2 years. So in 2023, we have an evaluation period whereby we'll be looking to see if we still can actually meet the STH target by 2030. And if not, we will have to revise our approach. And so at that time, we will be able to say, okay, we are not going to be able to get to where we are with the current approach. We're going to need to change this, and we're going to need to revisit it, or look for better anthelminthics. So I think the discussion is broader. For now, we will say, okay, let's keep on where we're having LF and LF treatments that will cover STH. But in 2023, once we've seen and once we are sure that we're not making progress, we either will agree to change our target. And I think this is something that's going to be very different about this roadmap, that we're not going to go to 2030 and say, well, this is what we agreed in 2020, so we're going to have to do it. No, we're going to, one thing is very clear is that we've decided that we will change the targets if it need be, so that, because there was a lot of issue of, there's a lot of ambition in the targets, there's a lack of ambition on the target. So the communities came round and agreed. So some of the targets that you're talking about, including the STH one, is one that the community has agreed that under the circumstances with the current tools, we can get to this in 2030. But there might be a situation where we will not. And I think by 2023, the important thing is knowing, can we or can't we, and should we change our direction? And I think this is the beauty about this roadmap, is about the ability to change course and the flexibility to change course. which is very important for all of us.
And kind of moving back to the program side of things, Fikre Gebre-Sadiq from the Ministry of Health Ethiopia. He is NTD program manager and is asking NTDs which are under intensive case management, such as visceral leishmaniasis, lymphatic filariasis, and morbidity management, etc., will be directly affected by the COVID-19 emergency, in the sense that the response of health facilities will be shifted to the emergency response, and availability of drugs and other logistics needed will no doubt be impacted and will be in question. What advice does the WHO provide for countries in this situation?
So we are currently in the process, like I said earlier, of developing guidance for these what we're calling IDM diseases. We're encouraging that their treatment should happen. Yes, it will be very difficult because the facilities will be focused on COVID, but it's important, and this is why we are working on this document that will cover essential services that need to happen for NTDs during COVID. And we hope that that document will be, and as soon as the document comes out, I will be out here again trying to explain the details of that guidance. But we're working very strongly on that guidance so that it can not only guide a couple of countries, but guide all countries in addressing the IDM NTDs, such as examples I gave was heart and leishmania, things like LF, morbidity management can be done at home, so that those are not direct. Surgeries for hydrocele and trichiasis, those are elective, so they do not have to be taken during this time. But we're thinking for those diseases that are, we don't, that have a life-threatening aspect to them, it's important that people do get treatment, and we are advocating for the treatment of these diseases during this time of COVID, and how we can support countries. If there is anything in specific, we will try to ensure that medication, that medicines arrive on time, that arrive at least to the facilities. We will want to check with you whether what you have on inventory, because that's very important, so that we know where we have problems. For now, we have lots and lots of delays with particularly the mass drug administration medicines. But for the IDM diseases, we will be back with more detailed guidance. But the most important thing is that the people needing these treatments should get them, and the health facilities should be able to cater for them.
Mwele, we're coming up to more or less an hour of the webinar, so perhaps we'll round off with a last question or conversation looking at maybe the future of NTDs and the NTD list. We've got here two sort of related questions, one from Francis Inagolet Olaki, a veterinarian in Uganda, Ministry of Health Uganda, and Peter Kiyoro, who works a lot on Tangiasis. So Peter was wondering what might be any future plans for looking at Tangiasis and possibly including this among NTDs. And Francis is asking a slightly different question, but looking at the difference, the clarification between emerging neglected zoonotic diseases and neglected tropical diseases. And so how can we kind of encompass all these conditions and diseases under the umbrella of NTDs?
So first of all, we can't encompass all the diseases that we'd like. We would love to do that, but we cannot. What we can do is take some diseases at a time. Currently, we're talking about 20 diseases. We can take those diseases and make sure that we do get traction on them, because I get this a lot of times when people are saying, well, why isn't this X on the NTD list and Y NTD list and why isn't Z on the NTD list? And I ask myself, we already have 20, of which we're only really making a lot of effort on 12. So the 8 are almost silent, so they become the neglected of the neglected. What we want to do is to make sure that we are able, and this is what we're doing through the roadmap, to manage the NTDs that exist in the current portfolio and try and make sure that at least there is something being done about each and every one of them. So that is the first, that's really important for people to understand, that just by adding doesn't mean that it gets attention. And sometimes it gets attention from researchers, which doesn't actually doesn't translate into money for programs. So yes, and this is why the Strategic Advisory Group for NTDs is working to find out how can they find a good classification methodology for the NTDs. Should we have NTDs that need more research and then have a separate list for them? Because if you put them on the NTD list, then we need to have some programmatic strategy for each of them. So it was like, mycetoma was on the list for a long time. Why hasn't anything been done about mycetoma? And so this is what we're trying to discourage. We're trying to make sure that we are able, as a department and as a community, to work around these NTDs. So for tungiasis, we are not currently going to have a separate, tungiasis is already being considered under the other ectoparasites. And so it's already there. And so if anybody needs to get traction for tungiasis, you can discuss it under the other ectoparasites. For neglected zoonotic diseases, we have a focal point for neglected zoonotic diseases, which covers the neglected zoonotic diseases which the department works on. And so I wasn't clear about that question, but we do have within the diseases, within the neglected diseases, we do have those we're calling NZDs, neglected zoonotic diseases. So I hope that's clarified it. But the most important thing is about us as a community, particularly the NTD community, not saying how much more can we add, but saying what can we do with what we've got, and then seeing, okay, if we need to add, which are the ones which need to go off the list, because that's what needs to happen as well. And so I think currently we need to be able to work on the 20 without feeling that we are being pulled to work on more with limited resources. It's a totally unfunded mandate. I have to say, the mycetoma got onto the list in, I think, 2016, but there was no funding for it. And there has been no funding for it. So we encourage, I really would like to encourage all the NTD community to really work with us on this and be supportive of us in terms of adding more diseases, because it is, at the end of the day, we just are limited in what we can do.
That makes sense how you've explained it, Mwele. I would take it as a compliment. Everyone wants to get on your list, so that's nice.
I take it as a compliment, but it's you know, we have diseases like teniasis. We have several diseases which do not have funds, and we are now trying to push for the recognition. So yes. Yeah, I take it as a compliment, but I also understand that there is a limit to how much one department which already has 20 diseases can do.
Absolutely. And if there's something we've learned from the COVID-19 situation, is that advocacy and awareness works in the strangest way. I mean, now we have small children who, within the matter of a few weeks, are perfectly versed in herd immunity and strains and PCR. So it's all about getting creative, I suppose, and looking for the many ways in which these diseases can be highlighted.
Exactly, and let's do that. And I think, I think also, again, people feel that, we will not get enough funding for research if we're not on a list. Then, then we might need to think about a list that is only for research, housed somewhere else and not in the department, but housed in another department housed in another division where the focus is research. We might be thinking of things like that.
Well, I think this, it's a good place to leave off. You've given us a lot of food for thought, Mwele. Thank you so much for that. I'm delighted to hear I might share my birthday with Carlos Chagas, who you said was
happy birthday
born today. Yeah, so it's an incredible honor for me. I'll have to double check that.
Yes, I don't know if it was the day I don't know if it's his birthday. I think it's his birthday. Or is it the day he discovered Trypanosoma cruzi?
It might be the latter, I'm not sure, but I would like to cling on to the thought that I might share a birthday with Carlos Chagas. So that would make my World Chagas Day every year.
Well, at least now we're celebrating it every year, so it's an excellent time.
Brilliant. Yes, absolutely.
Yeah, so all the sadness and talking about COVID-19, there are some things that we can look up to and gain inspiration from, I think.
Absolutely. And I think, we'll all be very much looking forward to hearing more. We're ready for June the 17th for the big virtual launch. So we'll be there to echo that, amplify that, share it, and make sure that NTD awareness is really heightened on that day and also along the next decade. We would just like all, I'm sure, to thank you very much for your leadership, that you're a very warm leader. I think you've been very inclusive, multidisciplinary, so that's really great, and we'll be very much watching this space.
Thank you. I'm part of an excellent community, though. I'm part of a very supportive community, and for that, I don't take it for granted. I'm very thankful.
Absolutely, and you've had a lot of thank yous on the chat here on the right. Obviously, a lot of colleagues who you've worked with over the years. Oh, Carolina Batista is letting us know that April the 14th is the day. I'm sorry, I've just lost the message. There we go.
The day he found the Trypanosoma cruzi, right?
It's when he diagnosed the first patient with Chagas disease in Minas Gerais, Brazil. Perfect. There we go.
Perfect. Thank you, Carolina.
Yeah, thank you.
I should have known that before coming online, but thank you.
There's a lot of dates flying around. We normally finish off with just kind of a little something that we share, something different, and so today I thought I would remind everyone, since we're all locked at home, and I hope it's going well for everyone, but we recently had something that we call our ISNTD Festival. It brings together creative approaches to NTDs, whether it be film or games, apps, etc. And this year, this was back in February, we had a book panel. So I just wanted to share with you the 3 books and the 3 authors that we welcomed as part of that. And so if you are looking for something to read, I can only heartily recommend this book. This is written by Christine Poulsen, An Air That Kills. It is a medical thriller. So Christine Poulsen writes herself that she used to be a respectable academic before she turned to crime. So there you go. If you haven't quite had enough of pandemics, here's a really great mystery novel about it. Another book we just wanted to recommend and share with you is this book, Under the Big Tree, by Ellen Agler and Moji Krigler.
Oh, excellent. Yeah.
It's a beautiful book. I think many familiar faces, many familiar names here, with a foreword by Bill Gates as well. So I can only recommend that. My third suggestion, I actually lent to a friend before the lockdown, so I can't show you it. However, I don't want to be unfair. So if I share my screen, maybe here. go. I hope you can see that. It's Professor Peter Hotez's book, which is Vaccines Did Not Cause Rachel's Autism. And if you want to hear more about these 3 books, you're more than welcome to jump over to our YouTube channel, and please subscribe if you would like all our updates, where we have a lovely panel discussion about these 3 books. There we go. So in conclusion, all the best to you, Mwele. Thank you again very much.
Thank you very much.
Thank you to all the attendees. Lovely to see everyone again today. And Mwele, all the best. Thank you again. And let's keep in touch.
We will. Thank you very much. And thanks to all the audience, and thanks for the questions.